Hi, my name is Dr. Amy Pate. I'm with Rocky Mountain Wound Care Specialists. I was previously a hospital-based medical director at a wound center, and due to lip barriers to access of care, lots of limb preservation issues, I decided to go independent. In that process, I found that it's extremely difficult to try to find anyone for payer enrollment, understand the process of payer enrollment, understand how negotiations and contracting even works. I tried contracting with some of the local contract negotiators up here in Denver. My vascular colleague had made some recommendations, the dermatologist colleague had made some recommendations. Ultimately, however, these companies were not super communicative and didn't really have time to explain what I needed. I found NGA Healthcare through Google. They were very helpful from the initial call, very helpful in understanding like the process of negotiation, the timeline, how rates are set, how fee schedules can be determined, what are a typical standard, what was considered an outlier. And, being a solo practitioner, this definitely was a very challenging process. Despite some lag on my end, NGA was actually instrumental in getting my contracts in place before I opened doors, actually right here in April of 2023. Most of them were done either within a month or two, considering I only sent things in basically in December of the prior year. They were extremely helpful in pushing back on lowball rates, especially with managed Medicare. Some of these payers range from like the high 80s to the mid 90s. They ensured that all of the managed Medicare came at 100%, which was extremely valuable considering that I have a wound care practice. Most of my patients are managed Medicare. The handfuls of commercials as well, they got me some excellent rates, explain the process, explain the likelihood, the risk of pushing back, the timelines of these things. So, I started this process not really understanding how contract negotiation works at all. And now I'm actually able to even help some other friends who are trying to go solo. So I would strongly recommend NGA Healthcare for any physicians or groups looking to negotiate or renegotiate their contracts.